Hello and welcome to my fourth podcast. For this podcast, it's called a Refocused Lens. I really encourage you to take a look at the artifacts and watch the TED Talk on perspectives. This podcast was really inspired how we use different lenses throughout to change our situation and to be able to apply holistic, person-centered care. When discussing refocusing lenses, I believe this topic heavily relates to the course content the most, as it involves all forms of critical thinking, HP lens, and relational inquiry. Throughout the semester and throughout this podcast especially, the different lenses utilized could include the feminist lens, the post-cultural lens, and the post-structural lens. These lenses can not only help us in adjusting perspectives, but providing high-quality, patient-centered care. Taking on a different lens not only can help us identify different inequalities individuals face, but can also help us shape our healthcare in a way by taking on new perspectives or stepping back and adjusting your mindset. This can lead to increased clarity and seeing factors that we might not be able to focus on before. Refocusing your lens as a nurse involves invoking a deeper level of relational and personal inquiry into your own perspectives and any biases you may have. I also believe we need to invoke relational consciousness into refocusing your lens, as it not only requires the nurse to focus on concrete situations and relationships, but also to recognize interpersonal, intrapersonal, and contextual factors affecting the situations. The first article I looked at discussed the concept of relational inquiry as it relates to patient suffering and involves the concept of relational consciousness. The importance of this is discussed as by taking on a relational inquiry and its approach, we can further in-depth analyze the underlying factors of patient suffering and develop a better therapeutic rapport by active listening. It further discusses how integrating the relational inquiry practice into our practice can help us challenge any biases or assumptions that we may have as practitioners. Additionally, it presents the idea that relational inquiry can also help us better identify the patient's needs, specifically with the hopes that it can lead to better outcomes and higher alleviation of suffering, as we can specifically identify underlying cause and seek out the specific resources and treatments our patients require. Without practicing relational inquiry and adjusting or refocusing our lenses, this article implies that we cannot provide as high quality of care and as patient-centered care given our underlying inter, and contextual factors that bias our care. When researching this topic for this podcast, I specifically sought out looking for post-colonial, post-structural, and feminist lens. After further research, I discovered so many different lenses you can unfold and adjust within the healthcare setting. When I was doing research for a second article, I was trying to specify my research on a specific lens we've looked at before. However, what I came across was a multitude of different lenses that we can take on and adjust given the different situations. For example, a lens that I saw was through the lens of a provider, and this lens was more of an ethical base of what is right and what is wrong and benefits and non-maleficence, and I thought that was interesting. Through the lens of the climate, seeing what would be best for the climate and the situation involving that. The lens of the country status and the lens of gender. Gender was a topic specifically related to men in an article I found, and I thought this was interesting as it was not something I considered given their status socioeconomically as a whole, and it made me inquire into the inequities that can face men, and I found this very important as to my development as a nurse. This research made me really understand how many different situations and viewpoints there are, and how we really need to be open to changing our practice by active listening with not only each patient we provide care for, but with each other, as there are so many different underlying factors going on that we may not see or understand. This further highlights the need for relational inquiry and refocusing your lens.